Hi guys, Akwaba. Welcome once again to Maame'B's Health 101, continuation of our mental health topics. Today, we are going to talk about PTSD, post-traumatic stress disorder. What is PTSD? It's a disturbing pattern of behavior demonstrated by someone who has experienced, has witnessed, or has been confronted with a traumatic event. This event can be natural disasters like the hurricanes, the tsunamis, and all that. Also, like people who went into war, combat, or an assault, like rape, a shooting incident. Yes, this, when people experience it, sometimes causes PTSD, post-traumatic stress disorder. Anybody can experience it. It doesn't have to be just older people. People experience it during childhood and takes it into adulthood. These people experience terrifying events and this continue throughout their lifestyle. It is very serious. We need to care for these people. We need to love them. We need to understand them. Let's say a person or a child was raped during childhood, of course, it goes into adulthood. Sometimes the person does not experience it until they are older. So the person will not show anything, or the person wouldn't even know they have it until they get married, and then the problem starts. Anytime they see the nakedness of their husband or wife, that event of rape comes back to them. PTSD. That's what I'm talking about now. Post-traumatic stress disorder. There are three elements of PTSD. Re-experiencing the event is one, and it can occur through dreams, nightmares. They will be dreaming about the fire that maybe killed their family, or the shooting incident, or that heavy rain, or that hurricane that destroys their childhood home, having nightmares. Another element is also avoidance or numbing. Efforts to avoid any person or situation that will take them back to their memory. They decide to even forget about any important part of that event. Hyperarousal is the third one. Finding it difficult to sleep, outbursts. They get angry early with little thing, difficulty concentrating. These are the elements of PTSD. So if you know somebody who is behaving that way, you need to seek for medical advice. The signs and symptoms occurs normally from 3 months after the event has occurred. It can even be years. It can delay till years before it happens. That's the example that I gave. Childhood through adulthood before it can show. These signs and symptoms worsen during stressful periods. So any time the person is having any difficulty in life, guess what? The PTSD comes back. And also other events contribute to that. Let's say somebody who has experienced, or the family has experienced, maybe gun violence. Anytime they hear a loud noise or any gunshot, they think it's happening again. Any person who has experienced rape, anytime they see a naked body, they think it's happening again. We need to be with these people, get closer to them, give them the love and the attention that they need. Depression, anxiety, alcohol, and drug use can also bring PTSD. If they don't have stable mind, it can take them back. Anybody can experience it. from childhood through adulthood. What are the treatments? Counseling and going for therapy really helps. There are also medications which are FDA approved that you can use or a loved one can use to help with the anxiety, the depression, and to put them online so that they can have a normal life. A lot of people around us experience it. So let us pay attention to our loved ones and let us help them. And then the American ho asem no PTSD. Nkurɔfoɔ a ɛkan no ɔmo kɔɔ war, obi wɔ hɔ a adebɔne bi ɛtoo no ne mufra bere mu. Onyin koraa na sɛ ohu biribi a ɛkɔ akɔsɛ saa adeɛ ne pɛ a na ne yam ahye no. Yɛmfa ne sɛ osua no baabi a ɔmo te hyeeɛ. Ohu egya pɛ a na ne yam ahye no. Obi ɛtoo ne mu na ohu ebi a bɛrima na ɔbaa wɔyi ne ho pɛ a na ne yam ahye no. Ne nyinaa ɛyɛ mental problems. Saa nkurɔfoɔ no ɔmo hia mmoa. Nduro wɔ hɔ, counseling ne therapy nso wɔ hɔ. Yɛn nso a yɛbɛn ɔmo no nso ɔmo hia ɔdɔ. Nti momma yɛma yɛni nkɔ yɛn ho sɛna obi go through saa nneɛma wei nyinaa a yɛbɛtumi aboa no. Meda mo ase bebree. Thank you for listening. Please, if you haven't subscribed, subscribe and share. Share. Thank you so much.